Today, I want to speak plainly about what I've been watching from Australia, the slow sunsets of America's health system. This isn't a gotcha or a political rant, it's a doctor to viewer reflection. The image that came to me this morning in the shower was simply a blue sky, a bright sun, and the light dropping degree by degree. At first, you don't notice. Then the shadows lengthen, the colors change, and if you're pretending it is still daylight, you stumble. In my view, the light started to fade during an earlier term of office a few years back. Key pillars were loosened, mandates that kept risk pools stable were zeroed out. Programs for the most vulnerable became easier to trim or fence off. None of it collapsed overnight, but like pulling threads from a jumper, the fabric began to thin. The message I heard again and again was that regulations were a problem and that health would improve if we simply took our hands off the wheel. That's not how it felt on the ground for ordinary people. For many, premiums nudged up, coverage became more confusing, and the sense of security that health systems should provide drifted. Then there was a brief sunrise in the next term of office. Subsidies were strengthened. The National Insurance Program for older citizens finally gained the power to negotiate certain drug prices. That matters in real life. If you're a pensioner deciding between medication and groceries, every dollar shaved off a prescription is a little more light in the room. For a moment, you could believe the sky might be clear. But in this current term of office, the sun feels like it has slipped below the horizon. Not because one side won and the other lost, it's because of what has actually been done in the health portfolio and in the public health leadership. The tone has now hardened even further from stewardship to ideological combat with its own scientific community and institutions. Seasoned people were moved on. Public statements began to promote unproven links, claims that sound scientific to the untrained ear but don't hold up under established evidence. When you elevate speculation to the same level as consensus science, you don't just get a debate, you drain trust. And once trust is gone, it's a very cold day. What does that cold feel like? First, the center of gravity in public health shifted away from agencies and processes that make health guidance reliable. You can disagree with the recommendation, and that's normal. But when guidance becomes a political football and experienced teams are cut out, reshuffled, or sidelined, the machinery that watches for outbreaks and coordinates responses start to grind. We saw that layoffs, the cost saving measures that landed on exactly the units you wanted to be strongest. Disease detectives, surveillance, writers, preparedness teams. Occasionally, walkbacks didn't undo the deeper damage. A stop start pipeline, people leaving, people coming, projects paused, morale crushed, doesn't fix itself just with a memo. Second, we saw a hard pivot on reproductive health funding and partnerships. Conditions that travel not only within the country but across borders. Whatever your personal views, the practical reality is that these rules cripple through clinics, through universities, through hospitals, charities, and all global health partners. We are now seeing these shifts spread beyond US borders, disrupting long standing international health collaborations. In practice, it means fewer trusted providers at the coalface, more confusion with the patients, and a chilling effect on honest counseling. And third, research and innovation were thrown into uncertainty. Budget drafts propose deep cuts to medical research and public health agencies, along with new caps that make grants harder to run, even where legislatures push back. Laboratories don't run on press releases. When grants are paused or indirect costs are squeezed, you freeze hiring, you cancel experiments, you stop them, you break them, and you lose the postdocs to other careers. What once was rumored is now measurable in publication. Publications have dropped. Staffing numbers, grant cycles has been broken. That's how you dim the future without anyone noticing for a few years until suddenly the pipeline of new treatments looks thin. The medical fraternity responded the way professionals do when they see the plane flying low. Letters after letters, resignations in protests, public statements, and legal challenges. Many clinicians simply said, "This isn't safe. This isn't safe." Some state leaders started building their own alliances to issue evidence based guidance and coordinate preparedness because the federal center no longer felt steady to them. Universities and research institutes warned they warned openly that cuts and compliance whiplash were already hurting real work. And trust, perhaps the most precious currency in medicine, slipped. When people hear senior voices casting doubt on vaccines and float fringe associations without proof, they start to doubt everything, including things that could save their life. Public health now depends as much on information hygiene as on vaccines, screening, and treatment. If you want a real example for why this matters, just look at the old enemies that thrive in confusion. Measles. Measles is the perfect example. In my earlier episode, and on in another in my earlier episode, I spoke about rising vaccine resistance here in Australia and what history teaches us about measles, how quickly it spreads, how many children used to die, and how grateful communities were once effective vaccine finally arrived. You only have to relax vaccination confidence just a little, and the virus takes the invitation. America now is facing its worst measles in decades, and the curve is still rising. Australia has smaller outbreaks too. And while one outbreak never proves a theory, the pattern is familiar. Weakened vaccination messaging disrupt surveillance, and you give an old disease a head start. That culture of conspiracies we see online doesn't stay neatly inside one border. It spreads too. I see it in the clinic, I hear it in my rooms, in conversations in the public. It spreads from the US to Australia and to the rest of the world. I know some will say, isn't this just politics? I know some will say, isn't this all just politics? My answer is health systems feel the weather of politics, but they are built or broken by actions. You can't run a system with different philosophies or opposing philosophies in the one unit. Some countries do it. And if you sideline evidence, purge experience, and treat public health as an enemy camp, the system doesn't just become cheaper or freer, it becomes brittle. And brittle systems fail the vulnerable first. The child who needs a vaccine, the pregnant woman who needs honest counseling, the older adult choosing between pills and dinner, the clinic in the rural areas lives month to month on grants and goodwill. These can be all lost and broken down. So from where I sit, the pattern across these terms of office, political office, is simple. First, the sun began to dip as guardrails were loosened and programs were constrained. Mm. Then there was a brief glow when affordability nudged in the right direction, and medicine's bargaining power finally stiffened. And now the light feels gone. Gone in places that keep a nation healthy. Surveillance, guidance, research, and trust. I'm not saying that there's no good work happening. There is. There is heroic work in hospitals, in labs, in local health departments every day. But I'm saying that the sky has darkened, darkened around them. What should the rest of us learn from this, especially here in Australia? Three things comes to mind. First, trust is not a slogan. It is the output of consistent evidence-based behavior. If leaders talk like influencers and are governed by impulse, people will rightly doubt the next alert, even when the alert is life saving. Second, institutions matter. You can criticize them, you can reform them, but you cannot run a modern health system without strong, independent public health system. Third, the information ecosystem is now part of healthcare. If we don't defend it, the rumors will eat our gains. And yes, some conspiracy energy has religious language around it, Christians included. As a person of faith or no faith, the calling is the same: truthfulness. Truthfulness, humility, and care for the vulnerable. Medicine must remain a place where truth has the microphone. And across Europe, across Asia, we are seeing a similar pattern: rising vaccine doubts, political polarization, and the slow draining of public health capacity. America isn't isolated in this. It's simply the clearest case study of how fragile trust can be, and how quickly it can just fail. Will the sun rise again for American healthcare? I hope so. Sunsets are not the end of the world. They are a warning of how we use the dark. Recovery will take time because rebuilding trust takes time. It will require protecting health expertise from the swings of ideology, funding research like our lives depend on it, and speaking clearly to the public about what we know, what we don't know, and what we are doing next. It will rise, but not because of slogans, only because of rebuilding. For my viewers in Australia and elsewhere, let's not be smug. The same winds can blow here. Vaccine doubt is here. Health misinformation is here. Budget fatigue is here. If anything, America's night should make us tend our own light more carefully, fix what's weak now, strengthen what works, and defend the places where evidence still guides the hand. And here in No Hype Health Talk, I will keep speaking plainly about what strengthens a health system: evidence, trust, the courage to see clearly when the light starts to fade. That's my view. Not perfect, not exhaustive, but honest. And I welcome your thoughts, especially those that work in public health or research, and you're feeling the same change. And also to my viewers and the public who are seeing the change and feel the changes around them. Share. Let's talk about what we can do in our own clinics, in our own communities to keep the light shining.